Hi everyone, my name is Amber Barthlow and I'm going to be talking to you today about the treatments of Parkinson's disease. There are three main types of treatments that are offered as the main forms of dealing with Parkinson's disease on all of the different websites that I viewed. The three main ones are going to be, there's something called deep brain stimulation, and I'll explain that in just a minute. We also know that medication is one of the main forms of treatment, as well as therapies for the development. Since we do know that people die with Parkinson's disease, there's not really a recovery in that, and so the treatments are basically a form of really training the person how to deal with the symptoms of Parkinson's and live an effective and full life. Going back to deep brain stimulation, this is something that they have done in order to replace previous brain surgeries where they would go in and create lesions on your brain. They're not really doing that anymore. Right now they're focusing more on this deep brain stimulation where they go in and apply electrodes to your brain, which is going to basically create impulses and stimulations in your brain that will trigger dopamine reactions in the brain. This one has been very effective in the treatment and I guess just prolonging the actual symptoms of Parkinson's disease. So this is a good one. Medication is also another really good form of treatment. We do know that there is a drug called it's called Levodopa. Okay, I completely messed that up, I know, and I practice saying it a lot too, sorry. And I'm sure that's not how you say it, but that is the number one form of treatment as far as Parkinson's goes that we have right now. The downfall to that is it is a dopamine replacement therapy drug, which means that it actually replaces the dopamine that has been killed through the process of Parkinson's disease. This drug basically is going to go in and act as dopamine in the brain, which is going to basically slow down the symptoms of Parkinson's disease. So without the medication, you might have more symptoms of the Parkinson's than while on the medication. While on the medication, though, there are some downfalls. People do see increased dyskinesia. I hope I'm saying that right. But essentially what that is going to be involuntary movements of the muscle in the body. So you might not be able to necessarily control your bodily functions as well as you might normally as far as movement goes. Another form of drug treatment is going to be a dopamine antagonist. This is more just like a it goes in and mimics what dopamine would normally do. It's not actual dopamine replacement. So it's going to go in and act as a dopamine, but not actually being dopamine itself. Some of the drugs used in this is Promaxolol. I'm sure I'm messing that up again. Ropenolol and bromoxazepine. Again, totally butchered those, I know, I'm sorry. But those are all examples of dopamine antagonists. MAOI inhibitors are also used, such as Celagene and Razogeline. COMT inhibitors are also used, and I'm going to refer to my handy note cards that you said we could use. As far as the COMT inhibitors, it's actually going to be catechol-O-methotrexate. Okay, I should get extra points for this totally for trying to sound like such an idiot on here. Just saying. Kidding. Okay, so this is actually going to be used in the brain as far as allowing larger amounts. It's used with also the first one, the dopamine replacement therapy that starts with an L, levodopa. Maybe I said that better this time. And that's going to work in conjunction together to allow more of the levodopa to get into the brain, therefore allowing more dopamine reaction in the brain. The pros for this one is going to be that it can prolong the action. So you're going to get more quality of life out of the life that you have left while taking these two medications. The downfall of this is that it does increase your risk of dyskinesia, which was also brought on by the levodopa, and that is again the involuntary movements, and it's also going to increase probabilities of hallucinations. So those are some cons that they have on that drug. The third one I did kind of already discuss, the therapies in development. They really suggest throughout all the research that I did as far as treatments are concerned, that you get involved with a therapy program that's going to inform you, keep you informed as to how to deal and cope with the symptoms that you're going through. They also do offer, specifically in certain churches, hospitals around generally local areas, so there might be one around Waxahachie, Midlothian, that you can go in, and essentially what they're going to do is they're going to talk to you and your loved ones about your sexual health. They also have advice for loved ones, programs that loved ones can go into and really learn how to help you deal with your disease. They have family help and support groups. So for the family members who maybe want to be helpful for you, also need support themselves. They have programs for sharing your diagnosis, where you can essentially just go in and learn more about your diagnosis, what's going to happen, and so on. Several other treatments that I found that weren't necessarily one of the three main ones that were located on the different websites that I researched are staying involved in activities. They really suggest that you increase your activities as far as just finding pleasurable things to do. They do talk about stress being very, very inhibiting as far as Parkinson's disease is concerned. So it's very important that you would de-stress as much as possible, whether that's taking a long hot bath, going for a nice walk, drinking some chamomile tea, whatever it is that keeps the person de-stressed the best. They do talk about staying connected, whether it's, just going to lunch with friends, picking up the phone, staying connected so that you don't start to isolate, because isolation is very dangerous in this disease. You start to feel depressed, and some of these medications may also cause depression. So you want to stay as well informed and also as active socially as possible. They do talk about it is very important in treatment that you're going to find a good doctor, which is probably one of the first steps that you would take in treatment. Finding someone that you trust, that you understand has a relationship with other people going through the same symptoms that you are, and it's just really important that they understand the background of the disease and can walk you through the different therapies that will help you and your family cope with this the best. They do suggest throughout the research that I did as far as treatment is concerned, that diet is very important. Diets high in protein are very essential to give back to your brain functions. They also suggest that you take in a lot of fiber, such as pouring flaxseed in your cereal or whatever you're having. Just trying to incorporate more fiber into your diet is very important. As a side note, some of the medications do inhibit your ability for your bowels to move properly, so constipation may occur in some of these treatments through the medication. So they suggest that the probiotics as well as a high fiber diet can assist in that nature as well. Exercise plans is also an excellent form of therapy. They suggest that relaxing and calming exercises such as yoga, taking a walk, going for a swim, these are all very relaxing and soothing exercises, as well as stimulating for your muscles and releasing dopamine in your body. So as a whole, I did find some websites that I'd like to share with you. As far as treatment is concerned, it seems like endless forms of treatment and endless research that I found on these different websites. One of them is the Michael J. Fox website, which is michaeljfox.org. Another one is www.pdf.org, and that is going to be for the Parkinson's Disease Foundation, I believe, but it's pdf.org. Another one is parkinsonsinfo.org, and another one that I included is also from the Mayo Clinic. It's mayoclinic.com, and they have a portion for Parkinson's that you can research on there as well. Very informative. Overall, Parkinson's it's important to say, not the same in every single person. So different treatments, it is important to talk to your doctor, talk to someone who has been through this in the past, and these help groups to understand really how to tailor fit your therapy and your treatment to your individual needs. Some people with Parkinson's disease can barely grasp a pencil, while others are still able to have the ability to go out and run marathons. So it's very different, and the scope, it's all over the place as far as different people are concerned. So tailoring your treatment needs is vital in your walk with Parkinson's disease. Thank you for letting me share. I hope everyone has a wonderful holiday season. Bye-bye.